Welcome, everybody, and thank you for joining us for today's program. My name is Amy Stein-Milford. I'm the Director of On-Site and Special Programs at DOROT, and this session on emergency planning for solo agers is part of our Savvy Day, or Solo Aging Visibility Day programming. And just with a quick show of hands, who knows what Savvy Day is? Okay, so for those of you who do not know what Savvy Day is, I will say it is the brainchild of today's speaker, Ailene Gerhardt, and other solo aging professionals. And what it is a national initiative that's meant to highlight the expertise, the creativity, and the resilience of people like you who are navigating the second half of their lives independently. So people who by choice or by circumstance are expecting to age or make decisions about your future on your own. And I want to say that Savvy Day comes from a real point of empowerment. And in that, it speaks directly to DOROT's mission. And we're really excited to partner in this endeavor with Ailene and other solo aging professionals and just people across the nation. And we have a full lineup of programs. To this one on emergency policy or planning is our first. In an hour and a half, we have something on policy solutions for solo agers that I really recommend. At 2, decluttering for solo agers, ethical decision making in healthcare for solo agers. And at 5 o'clock, a panel discussion that I really encourage people to come to. It is a discussion with 4 solo agers from across the country, and I really do mean across the country, from everywhere from New York to Hawaii. And their stories are really inspiring, and we address some of the questions that we hear most from people who are aging on their own. A little bit about DOROT. We're a nonprofit social service institution. We're about to celebrate our 50th anniversary this year. Our mission is to provide life-enhancing social connections for adults 60 to 100 plus. And we have many different programs, including volunteer opportunities. These include caring calls, friendly visits, package deliveries, and tech coaching. Our intergenerational programs, which connect older adults and teens through shared activities. Social work support, including an information and resources specialist, and the program that Carly, Claire, and I work in, which is on-site and special programs. And we present well over 1,000 programs every year on everything from art and culture to history and heritage to aging well. And we do this online, on the telephone, and in person here on our Upper West Side headquarters and also in Westchester. And all our programs are offered for free. One program that I especially wanted to highlight for today is our Aging Alone Together program. And I'm just curious, by a raise of hands or a thumbs up, how many of you have taken Aging Alone Together? It's wonderful. So welcome to those I see. For those of you who haven't, just quickly, this is our flagship program for solo agers, and it includes topics such as building community, where we live, advanced care planning, legal and financial decisions, and more. And the goal is not is two-part: one, to provide you with information and resources, but also to build community within the cohorts, the people who are participating. Aging Alone Together is a wonderful, wonderful program, but we know at DOROT that no one single program can address all of the topics that you are thinking about. And so we do a lot of programming on single topics, and that's what we're here to do today. And one of the things we get asked about the most is, what do I do to plan for an emergency? What happens if something goes wrong? And we are very fortunate to work closely with Ailene Gerhardt, who is an expert on this topic. And I will say, Ailene, and I have a feeling you're going to be sharing more about this, that You are an expert both in your professional experience and I think also in your lived experience. And so there's really no better person to speak to that, and also who has depth of knowledge and a kindness and a warmth. So I'm so glad you're here with us. I'm going to give your official bio, and that is you are the founder of Beacon Patient Solutions and the Navigating Solo Network, an independent board certified patient advocate, a national authority on solo aging, a solo aging educator and advocate, and a certified senior advisor. And as I mentioned earlier, Ailene is the driving force behind Savvy Day. And in her work, she is dedicated to a clear mission, and that is helping people navigate the healthcare system as informed, empowered, and confident consumers. And one last thing, Ailene, I know that you are trying to understand the needs and interests of solo agers. So Aileen's created a survey, and we're going to put it in our chat right now. And I hope that to help her understand more, you will fill it out. So Carly or Claire, if you don't mind sharing that in the chat right now, that would be wonderful. And I do see some items coming in the chat. Welcome, everyone. I see people sharing where they're coming from. Please do that. We love to know where you come from. You can also rename yourself in the chat and share a little bit about yourself. Amy from Brooklyn, or, whatever it is you feel like sharing. And with that, I turn it over to you, Amy.
Thank you. That is a very kind introduction. I have been fortunate to partner with DeRote and their fantastic staff for a number of years. And so having an opportunity to present as part of Savvy Day, actually to kick off their programming for Savvy Day, is a real gift. So for that, I am incredibly grateful. I'm going to share slides this morning. And give you some resources and actually share a QR code for a download later. If you have any questions, you're welcome to put them in the chat. Amy and Carly and Claire will sort of synthesize those, and we'll have time towards the end to hear those comments and try and answer some of those questions. It's not possible to answer all questions, and I'm not the right person for all of anything. So, but I can certainly help you out and get you in the right direction. So with that, I'm going to share my slides, and we'll get started, as long as technology cooperates. Looks like it is. Great. So thanks for choosing to spend the time with us right now. For some of you, it's very early in the morning. For some of you, it may be later in the day. I know there are people from all over. So I've stopped saying good morning. I usually start with good morning, very early morning, good afternoon, good evening, who knows at this point. So thanks for choosing to spend the time. This morning, we're going to look at emergency planning, and we're going to do it really from a strong perspective on healthcare management, emergency planning. But to be perfectly honest, any of the things we talk about are really able to be, utilized in other ways for planning. So just keep that in mind as well. The thing we know the most is that our emotions often reduce our abilities to really effectively plan. It's not that we don't have the skills. It's that we really truly are encumbered by our emotions. So we're going to try and apply some ideas that give us some control when we're navigating uncertainty. And I like this quote from former President Kennedy, that the time to repair the roof is when the sun is shining, right? So that's That's proactive as opposed to reactive. So, as I said, we know that what slows us down the most isn't the skill set we bring to the planning. It can either be what's sometimes referred to as analysis paralysis, of the feeling of overwhelm, of having too many choices, and not knowing what to do, and everything being obstructed by uncertainty. The other piece that I have found in my work, and in my own life is that the system, quote unquote, is often designed with templates that just don't fit solo aging intentional planning. And so, without what may be the support of adult children or adult family members, the templates that were offered in basic planning really create those speed bumps because we just don't fit in the same way. And because of that, that also triggers the emotions as well. For me, in the work I do it from a place of emotion aware planning, that it's not just about the tasks, but it's also about what we bring with it. So, in thinking about emotion, I think a lot about how we can shift the emotional state. If you know me, you know I am not a Pollyanna. I know very well that there are challenges and hardships that come with navigating aging in general, and most specifically for solo agers. But I also try to encourage people to come at it from a place of feeling in control, even when that uncertainty is so prevalent. So shifting to a place of confidence, removing the guesswork with our own informed knowledge base, having the resilience to build an infrastructure that helps us navigate life's transitions, whatever those may be, challenges and opportunities, and the ability to establish some peace of mind that gives us the opportunity to really live dynamically in the present. And so, you may be sitting there looking at the screen thinking, that's nice. I don't know that she thinks she's living in reality, but I am. Um, and I just wanted to sort of frame it that way. So when in my work, and it definitely aligns with the goals and the opportunities that are offered through the Aging Alone Together program, which is excellent, and I do highly recommend it. I look at solo aging planning and planning in general from 7 core planning needs. So you can see them on the screen. They're purposely represented equally in wedges in a circle, and they all connect in the middle. That's healthcare management, advanced care planning, residential, financial, legal, building that robust support network, and living a dynamic life. And so when we're looking at emergency planning, and most specifically healthcare management and emergency planning, we can see that it's one of the spokes, but that they're and a hub of one of the spokes. But the reality is that all we need is a catalyst to trigger all of the other components of that circle. And those ripples ripple through a healthcare situation, an emergency of some kind or situation, trickles our support system, a need for it, a need to tap into it. Sometimes it highlights our need to expand it. It can highlight our residential needs. It certainly touches our finances, can trigger legal. And and advanced care planning, and it definitely impacts our ability to live independently and living a dynamic life. So I decided to take the 7 wedges and sort of give the illustration. If we were to focus on the healthcare management wedge and then look at those different ripples, see how everything can be triggered and interconnected. And because of the emotion aware piece, I also look at what else that triggers emotionally. So, anxiety, loss of control, uncertainty, all of those things can really be a barrier for us when we think about planning of any kind, and certainly if we're planning for an emergency. And so, a good solution as a solo ager is that notion of proactive planning, of fixing the roof when the sun is shining, and not waiting for the leak or the heavy rains. And so, not only does it give you logistical support, it also gives you peace of mind. And it may sound like a really light, fluffy thing, but being able to live our lives without the weight of different things on our shoulders can really aid our health and our quality of life. So we're going to look at a couple of different components of putting together a plan. Again, most specifically from a healthcare management perspective, but it applies to everything as we think about planning for emergencies. So what we'll look at in this section is our in-network and what I refer to as literacy, what we know about in-network being who's covered through our insurance policies, how we research hospital safety, and then some tech readiness to be able to take the advocacy and the tools and your support system wherever you need them, regardless of whether someone's able to be present, physically present or not. So when I talk about the safety net of understanding in-network coverage, it's the kind of thing, again, proactively. It's not a good idea to be sitting, well, it's never a good idea to be sitting in the back of an ambulance, but it's really not a good idea to be sitting in the back of an ambulance wondering if where they're taking you is covered by your insurance. So the reality is we can do some of that basic research ahead of time. And so we can know what care facilities, what hospitals are covered by our insurance. We can be aware of the closest emergency room, our preferred emergency room, if it's not the closest, and know what's in network for you, meaning that it's covered as part of the insurance plan or plans you carry. And we could do a whole session on insurance coverage. That's not this session. But it's important to be able to have the healthcare literacy to understand the different components. The other piece is for us to ask, and you can call an emergency room front desk, you can call a billing department and ask if they contract with out-of-network providers. So people who may not be in network to their own facility or to people who don't take insurance. Knowing that ahead of time can help you make an informed decision. And that's the best thing we can make proactively, is being armed with reliable information to be able to do that. So there are 3 places that I highly recommend for researching hospital safety. One is an organization called Leapfrog that has a hospital safety grade website, which analyzes hospitals, facilities all over the country. Medicare website has a hospital compare tool that you can use by accessing their website. And organization called Health Grades also has an online platform that can also provide details as well. Uh, when you look up those things, you can see the different kinds of ways they're looking at hospital safety. It could be cleanliness. It could be um, adverse events, meaning things that could have been avoided. Those kinds of things can be listed. And if you're interested in knowing information about a clinician, a doctor, nurse, etc., who you may be working with, and especially with a surgeon, if you want to know how many times they've performed a procedure or any of that, you can use your state's website and use and go to the doctor licensing board. Um, and then it would be available there that you could look it up, as well as the Academy of the Association of the AMA as well. So um, to clarify, I realize that sometimes using language we're not all speaking in the same way can make it harder to understand. So when I refer to insurance coverage, I'm referring to private insurance, and I'm lumped in Medicare, which has a very different structure and whatever than private insurance and or supplemental insurance. So when I use the general phrase of insurance, that's that's a bucket, and I'm putting all of those in that bucket, as well as Medicaid. So any of those pieces, when I refer to insurance coverage, that's what I'm referring to. In terms of tech, we think a lot about tech, right? We have the opportunity to gather together, to have this conversation this morning and throughout the day, utilizing technological tools. And these tools can be really helpful even when we are navigating from a hospital bed or a care facility. So I always recommend that people download and have ready to go different tools that they can use electronically if that's something that interests them, to be able to bring their support network into the hospital room with them or care facility room, and or be able to do some advocacy from those tools as well, and for you to be able to be your own best advocate. So the general tools of Zoom, we're all familiar with that, or we wouldn't be here together. WhatsApp, Google's Meet, Facebook Messenger, as well as Apple's FaceTime. All of those have the ability to bring people to a location, even if they're not able to physically be there. They're able to listen to a doctor. They're able to interface with a nurse. They're able to take notes for you. All of those different things, even if they're not physically present. I'll give you a personal example. As Amy said, not only am I professionally really passionate about solo aging, but also navigate the world as a solo ager with a strong support system. I'm fortunate that way. And last year, I found myself in the hospital a few times. And whenever a diagnosis or something complicated was being explained, I asked, and I was fortunate enough to be able to interact with my doctors or whatever. I was in the hospital, but not debilitated that way. So that was fortunate, and I could advocate for myself. But I would ask the clinicians, because you need permission, if we're going to talk about this diagnosis or my treatment options, can I record this so I can share it with my brother, my friend who's an MD, their husband, their wife, whoever, obviously with permission again, but so that I am the most informed I can be, and I'm a partner in making decisions about my care. But just because I didn't go to nursing or medical school or PT or OT, physical therapy or occupational therapy, and I am fortunate to have some folks who will translate that for me into civilian speak. A tool like a phone or a tablet that can record something can be a real help. So um, it's also a great tool for everyday healthcare management, but most especially when we're in a situation that we may not have truly directly planned for. The thing that can be really, really helpful is to have a go plan. So an emergency plan. Um, so that can involve an actual plan and then a bag that can go with you in the event of an emergency if you're going from home or whatever. And so for these slides, we'll look at the anatomy of what to put in personal health records, the data that's really key and important, really look at a medication tracker from a practical perspective, writing up your emergency information and having it as part of a point of care tool. And then also making sure you have an instructive summary, or some call it a face sheet, as part of that plan. So as I mentioned, the personal health record really involves three types of information. You want front and back copies of your ID and insurance cards, Medicare cards, Medicaid cards, whatever. You want front and back because there's actually information on the back that's equally as helpful as the information on the front. A comprehensive medication list, which we will talk about, and I'm going to give an example, and then your medical history. And I don't mean from elementary school, although that may be relevant for some people, but really the really key components that help care professionals be able to know your story and your background and your history. And the reason that I will be recommending that on paper, even though I had a slide on technology and we're all joining together via technology, is because one, all the technological tools don't speak to each other. And two, and I say this often, so if you've heard this before, my apologies, but I have never met anyone who had trouble logging in to a piece of paper. I have interacted with many people who couldn't get their electronic health records accessed that day because of a dead spot or whatever with technology. Paper will always be available. It seems funny to say in 2026, but for these key components that tell our health story, it is really worthwhile to have them on paper and have them as backup in your preferred medical tool, technological tools, etc. So as I mentioned, what would those pieces of information be? Your ID, your insurance cards, your name, if you know your blood type, certainly your allergies, emergency contact names, the relationship to you, and their contact information as well. A current medication list that has the details of dosing, when it's taken, so the frequency, and why you take that medication. And again, that medical summary. And those are things you can print off of your electronic health records. I don't think everyone needs to turn into a scribe and write everything down handwritten, but having it immediately accessible is really important. Also, having an understanding of what a HIPAA release is. The HIPAA is the privacy rule that we have related to healthcare that without our authorization, someone can, if we're over 18, someone cannot access our information unless we authorize it. So in order for a friend to advocate for you or speak to a clinician, etc., having that HIPAA release is really important, as well as some of the planning documents such as healthcare proxies, a living will, or sometimes it's called a personal directive. So here's the piece of medication. I have worked with many clients, given many talks where people say, I have a list where I kind of know the name. I mean, it has, a long name and I spell it as best I can. And I know the pill is pink. Is that fine? Um, it's great to know what color the pill is, but unfortunately, that doesn't tell us what it's for, what the dose is, what the special instructions are. So, in terms of an actual medication list, it should be as comprehensive and as current as possible. Um, you can gather the various medications and write the names down off the pill bottles, off the labels, if that's accessible. You can print out your medication list from if you mail away or a local pharmacy if they have that technology. But it is important that you include the medication, what it's for, because the why is really, really important. The date you started that medication, who the prescribing doctor is, the dosage, the frequency, and then any special instructions. It might make me dizzy, or I feel lightheaded for the first half hour. Whatever it is, it's really important that that information is listed because it's another way to self-advocate. And so any information you can provide um, presents a fuller story and also signals to your healthcare team that you are strategically planned for the unknowable, right? Which is a weird sentence. That you've done the most you can do with the control you have to provide the most accurate information. And it really does make a difference. You can imagine my healthcare providers when I walk in with my personal health records, and ask 10,000 questions. They never forget that I'm a healthcare advocate ever. They don't even have to look in my chart. Um, so there's probably a middle point to that, right? You don't have to ask 10,000 questions, but you want to have the accurate information available for anyone who might need it. So another thing people often use is something called a file of life or a card that you fill out and that it goes beyond the basics. It gives a snapshot of your medical or personal profile. I have my own through my business, but they really are sort of snapshot information that you can put in your wallet, you can put on your refrigerator, you can put in your phone case if you're someone who drives in a glove compartment, and certainly in a go bag and part of a go plan so that information is available. And again, that gives the opportunity for advocacy. If you are unable to advocate for yourself, that information can be easily provided. And it takes that concept of, oh my goodness, I have piles and piles of papers, and also reduces it to an organized system of information. That's the most current and the most pressing for you in an emergency or a unexpected situation. The other thing really that's important is to have a face sheet or an instructive summary. It's a really great tool for solo agers, for everyone in general, but especially if we might be navigating a care facility stay or an experience on our own. Things like mentioning glasses, hearing aids, mobility devices that might be needed for everyday activities of daily life. Whether you're right-handed or left-handed, um, what your arm preference and location is for blood draws. You may be thinking, I never get to make that decision. They just walk up and stick me. Um, they More and more clinicians are asking, do you have an arm preference? As someone who had 64 blood draws last year, I definitely needed to give up my arm preference because both arms had to take one for the team. But I was asked initially. And if I wasn't asked, I was able to say, look, I'm left-handed. I prefer the blood draw in my right arm, if at all possible. If you can't find a vein, I understand, and we'll switch to the left. And also instructions about a condition you may have that really needs some details that you may feel them to be nuanced and maybe not important, but they really are important. What happens if they're missed? What happens if they're not at the right time? And all of this, by having this prepared, um, gives you the opportunity to set yourself up that from the instant you're interacting with these providers, you have that baseline of comfort, of independence. Now, you may also be thinking, she knows they have to read this information, right? And so you can present it that way. I brought with me my 5-page personal health record or whatever that includes my medications, my emergency contact, who my healthcare proxy is, whatever. Would you like to review it now? Do you just need to know I have it? All of those things can be really, really helpful. And also, when we're able, indicates that we're a partner in our care. So I have put together a one-page checklist of all of these different things. There's a QR code on the screen. You're welcome to scan it and download it, as well as the website where you can download it, which I will drop in chat during Q&A. Um, but this is just a sort of overview of what you can put together in a bag. Now, putting something in a bag, the hope is you're putting that bag together and it's collecting dust in a proverbial corner, that you never need it. But the reality is we often do need it. I realize this is only good, this bag, if you're coming from where the bag is located. But let's presume all of those things are quote unquote ideal conditions. It's good to think about these things ahead of time. Extra glasses, extra inhalers, hearing aid batteries, uh, disinfecting wipes for wiping down equipment in your care facility, or if you're visiting someone in a care facility. Things aren't as clean as you may think they are in that care facility. So it's always good to wipe off surfaces, etc., that you may be interacting with. A communication kit, all of the gadgets we need to keep our gadgets running, power banks, chargers, cords, all of those different things. Having extra just sitting and waiting to be utilized, or hopefully never utilized, means they're available when you need them. And it's really helpful to bring a notebook, pens, and a clipboard with you so that you have places to write down information, take notes, be able to refer back to those notes. And the next slide will explain a little bit more about that. If you have the opportunity, things that are provide comfort and security. As I said, gadgets, ebook readers, tablets, phones, earbuds, headphones, a book, a magazine, photo that will bring you comfort, um, travel toothpaste, toothbrush, hairbrush, extra socks and extra underwear, a change of clothing. Just because someone's spending time in a medical facility does not always mean that they need to stay in the very flattering gown that they give you. And you actually can often wear your own comfortable clothing as long as they can access whatever is needed to access. Things not to put in there, valuables, jewelry, that kind of thing. It's also really important to make sure your emergency contact or contacts have your information, and also uh, reach out to the nurses station to have, which is a central location where all the nurses check in on a hospital floor or a care facility floor. It's usually where a lot of the ambient noise comes from if you're in a medical facility and your door's open. Um, and that way, someone can call that number directly and get some information if they're authorized to do so and advocate for you that way. Here's a list of why bringing paper and a notepad is helpful. Writing down questions, writing down the answers, taking note of meds that have been stopped or started. Um, you can write those down. Uh, Not everyone reads their electronic records. It's good to have those notes with you written down. Make a list of supplies you might need after you leave a care facility, and also who might be uh, helping out afterward so that you can indicate who will do those things. Um, I'm going to say very quickly, although this isn't a very quickly process, but advanced care planning is really important. What I have noticed for solo agers is that the stress, the overwhelm, and the quite honestly panic over having a healthcare proxy usually stops people directly in their tracks from doing any of the planning. So the way I look at advanced care planning is with 5 Ds. The first is you need to do your homework and decide what you want and don't want. Then you need to write it down. Then find the best person to designate. Then you discuss it with them, and then you distribute that information. DeRote works with great partners on advanced care planning and what matters now. It's a great resource for that as well. So that's how I look at the process. I also really encourage people to think about not only, okay, I might need a health or I need to have a healthcare proxy, but is there an opportunity for a short-term designation? We do not need to choose who is going to be our health proxy the rest of our lives on a Wednesday in May. We just don't. If you know you're having a procedure coming up and you need someone for that, see if you can approach someone to be a proxy for that. It gives you the ability to test the relationship and to see how that person will do in honoring your preferences. Now, this is a list of if you have the opportunity to really give thought to who should be your healthcare proxy. As a reminder, not everyone was born to be a healthcare proxy. You want to think about how these individuals will be able to advocate for you, speak up on your behalf, regardless of what their beliefs are. So you want to make sure that they're able to consistently do that, regardless of whether there's an emotional conflict for them, um, or they don't agree with something. They still are in charge of carrying out your preferences. A proxy is simply a stand-in. That's all it is. Um, and so we need someone to stand in for us who will advocate for our preferences. That's another review of the process as I sort of look at it. The other thing I want people to think about as we shift to comments and questions is, okay, you've looked at a bunch of slides, and hopefully some of it's been helpful. But in terms of, okay, once I have thought about this and gone to all these great programs that are being offered throughout the day, and I have some time to digest all the information, is there a task or a phone call that I can make this week um, that can add to me taking action? So some of the things I put down as examples are identifying an in-network hospital, making sure your medication list is up to date, buying a portable charger, etc. Um, so that's the information. That's the information about me. The folks at DeRote always know where to find me. Um, and I appreciate the time of the listening, and I really want to hear the comments and as well as any questions.
Ailene, thank you so much. And there are three big questions that have come up from quite a few people in the chat. So I'm going to elevate those. And then if other people have things they'd like to ask as well, you can raise your hand. We have just another 12 minutes. The first thing I wanted to say is there are a lot of questions about what we're sharing. This recording is being shared. Aileen's website and contact information is being shared. We're going to actually be sharing all of the presentations from today in one email that will go out later this month. I did not approach Ailene beforehand about sharing her slides. I know sometimes that some of the slides are proprietary. So Ailene, just quickly, are there any of the documents that you've presented that you can share with the group?
What I can do is compile a resource sheet, which is a summary of all of the information, but isn't the slide by slide of 18 pages of slides no one needs. Um, and that way, that can be a resource to folks for follow
That's
up.
fantastic.
Yeah,
Thank you. I
you're welcome.
so And so that was a question that was asked by many. So we will share all of those materials with you, not today, but this week. The second question, and it's come in a number of forms, it came first, and you addressed it in some very strong and compelling ways, is the question that we hear the most. And it's what will happen if you don't have a healthcare proxy. I loved how you talked about deliberating and documenting. You don't need to have the proxy in place right away. Can you speak to that, though? There is, I think amongst people who are aging alone, and someone wrote in that they really don't have anyone. They don't have family, they don't have friends, they don't have neighbors. If you feel you truly are alone in that way, what are your, and you've addressed it in some part, but if you could just go on that one, what to do? What are the most important steps?
So if you truly feel that you do not have anyone to designate, um, you can look to certain professionals sometimes who can be hired in that role. If you live in California or Arizona, and only those two states in the United States, you can hire a fiduciary, someone who can be a part of your representation team and know all of the things you want and don't want from the get-go. If you live in the other 48 states or any of the territories, you can't. Um, that's a whole nother rant for a whole nother time. Um, but you can seek out, sometimes there are elder law attorneys who may be able to serve as a healthcare proxy. There are some companies now that are offering trusts and other resources that you can sign up with a subscription fee to have the professional entity um, be your representative, the answer isn't as clean as, oh, well, if you don't, do this. But if you don't have that ability to designate someone, then the choices are taken out of your hands if you can't advocate for yourself. So in your friend group, acquaintance group, connection group, um, it think about, are there ways that you may be able to approach that conversation? Again, things like what matters most, resources I have on my website for advanced care planning, all of those places can help with the conversation. I understand there may be a reality of truly no one, but I would try and exhaust every possibility and also think about there at some point were 185 rectangles on the screen. Taking out the four of us who are staff or presenters, right? That's a lot of people who may be looking for their healthcare proxy. And the other 120 something or 50 something who weren't able to join us directly also are probably thinking about that. So why am I using that as a very silly example? Because when you're attending solo aging programming or programming in general, people are there because they're like-minded. They may not root for the same sports team, but they are trying to figure out navigating their way, and even stepping outside of our comfort zone, as truly uncomfortable as it is, and it can be, is worth it to be able to foster a relationship to whatever degree you would like, to be able to have someone advocate for you, and you can offer to advocate for someone else. So keep that in mind. That's not a direct answer, Amy. I'm very sorry. There isn't a go to page 6 and, or 73 and here's your answer. I'm sorry.
No, it's a great answer, and I think if there were a simple how-to, we would all have it on our website and we'd be mailing it to you. But there are strategies and you've and resources and you've shared them both. The other question is sort of the inverse of that one. A couple of people have brought this up. I brought info to my doctor and was told they didn't have time to read it. From my experience, after calling 911, EMS will only take you to the nearest emergency room. So we hear of these stories a lot. And I do think sometimes you plan, you do everything you can, and something doesn't happen the way, you had hoped it would. Can you speak to that a little bit? Like, what can you do to try to have the outcome you most want, with the recognition that sometimes things
It's not in our
don't quite,
control.
yeah.
So as for the bringing in the information and the clinician telling you they don't have time to read it, you can call the clinician's office prior to your appointment, speak to someone who answers the phone. They're also short on time, but they will be able to approach it in a different way than the clinician who has a 20-minute appointment scheduled, and say, I have information I would like my doctor, nurse practitioner, occupational therapist to read. Can I drop it off so they can read it ahead of time? Or how do you help patients in that situation? So it takes us advocating for ourselves that ideally we'd be able to walk in and say, here's all my information, ready, set, read. That's not usually the way it works. But ahead of time, we can ask how we could get it in the hands of the clinician or how they help other patients who might have brought that up. Again, that doesn't mean it'll get where we want it to go or that the homework will be done. But we've taken our part in providing that in advance, so it's not a in the moment thing, which usually often does not yield what we want. As for EMS, it depends. Different companies have ambulance companies are not regulated in the way you think they are. They do not have universal anything. So If there is a hospital that you prefer to go to, not in another state, but whatever, you can share that and ask if it's a possibility. If they tell you they then need to take you where they have to go, um, that's a situation. That's another thing where you can call, sounds weird, call non-emergency lines, but call an ambulance company ahead of time and ask them what their protocol is. It sounds absurd. I understand that. Um, but it means that we then have the information to make an informed decision. And we are our own best advocates when we have information that's reliable and we're not making assumptions. I'll give you an example. On January 6th last year, I was sitting in the back of an ambulance for the first time in my life. Unbeknownst to me, I had had a heart attack. Um, I said to them, what hospital do you have to take me to? And they said, what hospital do you want to go to? So even I had that sense of, I have no control in this situation, never mind whatever was going on with my cardiac system. So, um, but I got to choose what hospital I went to. Um, so uh, asking, you can, if you're able to, or if you have someone to accompany you, or if you have paperwork that says where you would prefer to go, note it down, note it on the paper. Um, because sometimes EMS is bound by protocol and sometimes they're not. And I wish that was a standard answer, but it's not.
Okay, we're just at the hour. I see a lot of questions in the chat. I do want to share something at the end, some resources for people. So, Greg Sutton, if you want to unmute and just do a 20-second question or comment for Ailene, and then we're going to close it up and suggest some other places you can find resources. Greg, did you want to unmute? And if you don't mind, just quickly, uh, I'm inviting you to unmute, and if you're not able to, just send it to us. Looks like we're at 11:59, so I'm gonna close it down now. Ailene, is there any last word of wisdom you want to share with us? I'm gonna add some suggestions from Joe Roth, but I'm so grateful for your guidance and so many incredible suggestions, resources, strategies, and information. Any last words for the group today?
Remember, when you are in a medical room, exam room, OT, PT, appointment, care facility, there's always an additional expert in the room, and that's you. You are the person who lives with you 24 hours a day and knows every single thing about you. Do not forget that, even at a time when you are not at your best. It's really important to remember you are an equal partner that way.
That's a great piece of advice. Thank you so much, Ailene. Thank you for creating Savvy Day. Thank you for speaking with our community. I want everyone to know there was a lot that came up in the chat. The staff and I, we will all be looking at it, and we're going to be sending our usual extensive follow-up email later this week. We'll include recordings, we'll include that consolidation of information from Ailene. And if we think there are topics that you're asking that we weren't able to properly address, we'll see if we can include a resource in the follow-up email, and know that our program ideas come from your questions and your comments. So many of the things that you were asking about are things we've programmed on, and that we will indeed in the future plan for. So thank you all. I hope to see you at other programs for Savvy Day. The next one coming up is not decluttering, it is
Policy.
policy. Policy solutions for solo agers. I hope you can join us. Check our website if you need the link. And thank you, Ailene. And thank you, everyone. I see faces I know and new faces as well. It's great to be in community.